Welcome to our channel. Today, we're giving you a short, clear, and professional step-by-step guide on how to qualify for Medicare benefits as a new applicant. Step 1. Know the basic eligibility rules. Most people qualify for Medicare at age 65. You may also qualify earlier if you have a disability and have received Social Security disability insurance for 24 months, or if you have conditions like end-stage renal disease or ALS. Step 2. Understand the different parts of Medicare. Part A covers hospital care and is often premium-free if you or your spouse worked long enough. Part B covers doctor visits and outpatient care and usually requires a monthly premium. Part D provides prescription drug coverage. Knowing what each part covers helps you choose the right plan. Step 3. Check your enrollment window. Your initial enrollment period lasts 7 months, 3 months before your 65th birthday, your birthday month, and 3 months after. Applying early helps prevent coverage gaps and late penalties. Step 4. Apply through Social Security. You can apply online at ssa.gov, by phone, or at your local Social Security office. If you already receive Social Security benefits, you may be enrolled in Parts A and B automatically. Step 5. Review your coverage options. After qualifying, decide whether to stay with Original Medicare or switch to a Medicare Advantage plan. Compare cost, provider networks, and available benefits to choose what fits your needs best. Step 6. Keep important documents ready. Have your ID, Social Security number, work history, and health insurance information available. This helps your application process move quickly and smoothly. Thanks for watching. Don't forget to like this video and subscribe to our channel for more helpful guides.